Good evening, everyone, and thank you for joining this My Health Career Navigator webinar. This is Olivia Shorter. I am the Regional Program Manager for Health Career Connection, and I also work with Jeff Oxendine here at My Health Career Navigator. So we have an exciting webinar and panel planned for this evening on careers in public health and medicine. This is the fourth in a webinar series designed to help support you in exploring various health career options, coming up with strategies on how to get there, and really exposing you to a breadth in different fields and professionals. So this is the fourth in our webinar series. All of our webinars are recorded and are posted to myhealthcareernavigator.com in our videos section, so you can access those. This webinar will also be recorded and posted there, so if you miss anything, you can take a peek down the road. We are also fielding questions, and we'll leave plenty of time to answer your questions at the end, so please send those to us using your GoToWebinar chat box. Christina, our webinar organizer, and myself will be collecting those, and we'll be sure to read those aloud to our panelists. So with that said, I'll go ahead and get started. This evening we have two exciting guests joining us who are pursuing careers in public health and medicine. And the goal of tonight's webinar is to provide you with some insight into the path and the journey into pursuing this joint career. What might the benefits be of including public health in clinical and medical practice, and what does that look like if this is something that you're passionate and interested in. So we have two guests that will speak on that. As I mentioned, we'll leave time at the end, and if you have any questions about the webinar or anything moving forward, you could email us at myhcn1@gmail.com. So we'll go ahead and get started with our first panelist, who is Evan Russell. Evan is a MD PhD candidate at Johns Hopkins School of Medicine and Bloomberg School of Public Health. Since developing an interest in international health, Evan has lived on 5 continents where he's worked on a variety of projects ranging from health systems training and performance assessment to health technology implementation, as well as scaling up health access in urban populations. He's held leadership positions in public, private, and nonprofit sector organizations. He has also held several fellowships, including the Barbara Jordan Health Policy Fellowship and Medical Scientist Training Program. As I mentioned, he is currently an MD PhD student and also a graduate of Brown University. So it's my pleasure to introduce Evan, and again, send us any questions you might have for us. Welcome, Evan.
Awesome. Thanks so much, Olivia. So I guess I wanted to start off with a couple of different topics. I kind of coming into this had a couple of questions that I think, maybe 10 years ago I probably would have asked myself. So maybe you have some of these questions already. I know I certainly did. So I think the first one for me was kind of how I got started in public health and medicine. And I know this story is very different for many people. For me, it actually started with a general interest in kind of helping people. I know it's a little generic, maybe even a little corny, but I kind of remember back to my days in high school, spending a lot of time volunteering, really getting a lot of gratification out of doing things that really made an impact, whether that was just on people's personal lives through things like tutoring, or more widely through the community, through working with maybe schools, or I think I coached like a lacrosse team for a little bit. I found those types of things to be really gratifying. As I moved forward, I kind of thought about, through college, what are some ways that I could do that as a career? And so there's this moment, I guess my freshman year, when I was taking this history class and also this chemistry class. And history was fun, but the chemistry, for some reason, was just more interesting. And so, I kind of blamed that moment on kind of bumping me down the science route, and obviously I haven't really turned back ever since. Now, I kind of started with this interest generally of combining helping people with science, and probably for many of you that's kind of gotten you interested in medicine or public health. But from there, there's a lot of different kind of general ways you can go. So for me, I got the opportunity to work in some community health organizations, and that was really awesome. I did a little bit of research kind of on the side, some bench science stuff that it turned out I didn't really enjoy that much. And then kind of towards the end of college, got the chance to study abroad. I went to South Africa, which was very, very different from a lot of the places that I had been before. Really, my first big trip outside of the U.S. To that day, and obviously South Africa is a very different place from Rhode Island to Brown, so quite different. And I think a lot of the experiences I had there really said, there's a lot of need out there. There's a lot of things that, with some basic knowledge of healthcare, I could really, do to make a difference. But also, it's more than kind of the individual level. There's a lot of community issues. There's a lot of policy issues. There's a lot of international issues that are really important and really can make a big difference in people's lives if they're changed. I was fortunate enough to spend some time kind of seeking really good mentors, and some of those people fortunately got back to me and allowed me to work with them. And I think kind of seeing how their careers, some of them were researchers, some of them were folks who worked in community organizations, and seeing how their different careers turned out, seeing the things that they did, the people who they impacted, those things were really energizing. And so after college, I worked in health policy first. So I interned in DC for a little bit, which was tremendous. It showed a lot of the ways that people who were, kind of controlling the medical system were doing a lot of good, but also, they might be thinking more about kind of the patient care issues, and so that was more their focus on kind of individuals, while other people had more training in kind of the population health issues, and so they were thinking more about populations, but with less of a kind of perspective about what healthcare practitioners actually did day to day. And I could see kind of the ways that both of them were right, and also some of the ways that both of them were, maybe not doing the best for the folks on the other side. So with that in mind, I started working for a global health nonprofit and started applying for graduate school. For me, and we'll talk about this a lot more throughout because there's obviously other perspectives on this. For me, I really wanted to get a lot of training in public health, and this had really been inspired by some mentors that I'd had before, who one in particular who was an MD PhD and did kind of very basic kind of like clinical type of research, but then use that work and use the statistical knowledge to turn that into larger scale policy. And so for me, that was a really great example of a way to kind of solve this problem that I've been encountering in different ways, both throughout my volunteering and obviously in the extreme in that experience in DC. So I was applying for PhD programs, fortunate enough to get accepted at Hopkins. And since then, I've really been seeking out ways to combine these things. So MD PhD, I'll just give you a quick overview. Usually you do your first your first preclinical years where you study, all the stuff of being a doctor. Then you go out and you do your PhD. For public health folks, that's usually some sort of field work or some sort of data analysis, and that was certainly the case for me. I worked in a couple different places, Uganda, Afghanistan, Chile, and a couple others for smaller trips. But those are the big things. And for most of those, I did data collection, analyzed data, and then eventually published most of the work. And then after that, you go back to your final kind of clinical experience. So for me, that's been going through surgery, obstetrics and gynecology, emergency medicine, all that good stuff. So that's kind of where I've gotten thus far. I'm applying for emergency medicine residencies next. The second question that I just wanted to cover real quick was, how does this help? So I've been a trainee for a long time. I think I started graduate school like 2007, and I'm getting towards the end. And especially now that I've been back in kind of clinical rotations where every day, I'm taking care of patients, you can really see where, and it's not just training in statistics, it's training in understanding how to interpret data, how to collect data, how to analyze data in a better way. And then through the clinical side, how to apply that data to real people and real situations. And I've seen experiences, we had one just today with one of our fellows. I'm in the pediatric intensive care unit. One of our fellows is doing research on infections in the PICU, and some of the methods I could already see from what she was doing could be improved. There were conclusions that were in my opinion, were not necessarily correct. And because there really weren't many people with statistical backgrounds or really kind of the basics of understanding in the room, a lot of those assumptions and a lot of those kind of incorrect ideas were things in a room of 40 health professionals at an excellent hospital, an excellent intensive care unit. Those things will probably get implemented simply because there wasn't really a lot of, there wasn't a lot of criticism. There wasn't a lot of, kind of thoughts on other methods. Now, and I should say, to her credit, it was awesome work, tremendous for that level of training, but there's a lot more that can be done with the study, with the approaches, with the methods. And those are the kind of the directions as, a future health professional, I guess a current health professional, and as a physician, and as a researcher in the future, I want to be able to kind of solve both of those things, to be able to walk into a room, see the patients, walk out of the room, think of a way to solve that problem, and really do it on a large scale. So that's kind of the direction I'm going. Residencies next, I'm sure. There'll be a lot of opportunities there for these types of things. But there's a lot of ways, a lot of areas, a lot of times throughout my day, I see problems that, with some clinical knowledge, with some public health knowledge, you can really make a big difference for real people. So those are kind of would have been my big two questions for myself, and I'll stop there.
Perfect. Thank you so much, Evan. And I already have quite a few questions that I imagine we can move to Janet to add some of her experience and then open it up to the audience to get into a little bit more depth on some of the things you've talked about. So thank you so much for sharing your story and sharing your insights. So for now, we'll move on to Janet Chu. And Janet has her MPH from UC Berkeley School of Public Health and is an MD candidate with UCSF School of Medicine. And Janet graduated from Stanford University in 2010 with a bachelor's with honors in human biology. Her area of concentration was biomedical technology and public health policy. She's currently a fourth-year medical student at UCSF. And as an undergraduate and medical student, Janet volunteered at various health clinics serving marginalized and underserved populations, and that's both at a local and international scale. Before starting medical school, she participated in a research fellowship that focused on conducting a needs-based assessment for victims of Agent Orange in Vietnam. And in the future, she hopes to combine her experience and skill sets from both her medical education and public health training to practice medicine with an awareness of social determinants of health, for the goal of improving the health of underserved and underrepresented communities. So with that, I will hand it off to Janet.
Thank you, Olivia, and thank you so much for having me on. I'm really excited to be here and talk a little bit about how I pursued medicine and also in public health, and how I hope to combine both of those passions in the future. I think my initial interest in health and medicine started as an undergrad at Stanford. I did a lot of robotics in high school, and I got really excited about the potential of technology and how to incorporate that into health. And the more and more I worked with some of these robotic technologies and working with physicians and trying to figure out how to improve upon these technologies for the patients, I realized that I was much more interested in the interactions between the physicians and patients than I was in prototyping a lot of the medical devices that I worked with as an undergrad. And I also volunteered, as Olivia mentioned, I volunteered as a Vietnamese interpreter and health educator at free clinics in the area. And I realized that I would find it much more fulfilling to practice medicine in underserved populations and working one-on-one with patients than I would in a lab. And that's how I started to pursue my career in medicine. But the thing that I realized during my interactions with those patients, and then also when I went to the Philippines and worked with families who got recurrent gastrointestinal worm infections, was how much environmental factors and socioeconomic factors impacted health outcomes, health behaviors. And I think that's really where my interest in public health began. And so entering my junior and senior year of college, I decided to apply to medical school, but knowing that I would, somewhere along my training, also get public health training. So after I graduated from Stanford, I finished some pre-med classes in the gap year, but also went to Vietnam and did work on Agent Orange and dioxin. And again, there I worked on the ground level, working with individuals and families who were impacted by Agent Orange and dioxin. For those of you who don't know, Agent Orange was a defoliant sprayed during the Vietnam War and has led to a lot of health and environmental impacts now 30 years later even. And in addition to working with individuals, we worked with nonprofit organizations, we worked with community organizations, and we worked with policymakers on a governmental level to try to figure out different ways of intervening on some of the social and environmental and health impacts that we've noticed. And that is really where I was inspired to combine, like sort of think about how to combine my interests for medicine and for public health. And so in 2011, I was fortunate to start medical school at UCSF. Like Evan, did 2 years of preclinical training, then started 1 year of my core rotations, and that's when I decided that I really wanted to go to get public health training at UC Berkeley. I wasn't really sure what I wanted to do, what specialty I wanted to pursue, and I felt like having the time and getting the training in public health would help me guide what I wanted to do in the future. And so I applied to UC Berkeley, and I really wanted to work specifically in the Bay Area because this is the population that I wanted to work with. I think a lot of my contacts were in this area, and so I decided to apply in the Bay Area as opposed to going other places. So I spent a year, a lot of work in qualitative and quantitative methodology, in health policy, still really interested in technology, so also took classes in health technology and policy advocacy as well as media advocacy. Worked with some local nonprofit organizations looking at global health and how to conduct impact evaluations for their programs. And so I gained a lot of hard skills that I think that will help me in the future in what I want to do. And after finishing this past year my public health training, I came back and am finishing my 4th year of medical school now, applying into internal medicine. And I think what I learned from the year in public health was that I was hoping to gain experience working with individual patients and then figuring out the social determinants of health, the social environmental factors on a community level that are impacting those individuals, and hope to develop interventions with those in mind that will help impact and improve the health outcomes and the health disparities that I saw on a day-to-day basis working with especially underserved populations. I think that some of the biggest impacts on my journey, which hasn't necessarily been traditional, have been, as Evan mentioned, some mentors that have been incredibly helpful in helping me shape the path that I've gone down to go into medicine and public health. I had one mentor specifically at Stanford who did both public health training and is also a physician and really helped guide and mold my career path. And then also a lot of my volunteer experiences I think have really shaped my career, especially working with the Vietnamese population in San Jose and especially the populations I worked with abroad in Papua New Guinea and the Philippines and Vietnam. And I think that all of those experiences have really helped me figure out what I want to do in the future. And I think that's going to be working as a clinician, a majority of the time to, help take care of patients who come into the hospital, but then also working as a public health leader, trying to determine how to help underserved populations gain health equity and try to address some of the health disparities that they face. And so I'm excited to answer any of the questions that you have and look forward to those of you who do decide to pursue a career in medicine and public health.
Thank you so much, Janet, and thank you to both our panelists for sharing so much about their own journey and the decisions that they made that ultimately led to where they are now. So for really a majority of this webinar, we want it to be interactive and for you to have as many opportunities to ask your questions. So now what we'll do is move into question and answers, and I have some questions that I'd like to start with. We've also had a number of questions sent in ahead of time during registration. But at this time, if you haven't had a chance to already, please do send us your questions using your chat box. If you're calling in by phone, if you're able to email us questions, you can, mightstand1@gmail.com. But for now, we'll go ahead and start with some of the questions that were sent in advance. So this first question is for both of our panelists, and both of you spoke about some of the experiences that you've had prior to graduate school that really impacted your decisions. You spoke about volunteer experience, internships, fellowships. So our first question is, how can pre-med students and public health students now, whether they be currently in college or recently graduated, start getting experience that will prepare them to pursue medicine and public health at a graduate level? Are there any specific programs or types of experiences that you recommend that they start thinking about now?
Jenna, you want to kick off first?
Yeah, sure, I'm happy to. So a lot of the pre-medical experiences that I participated in were through my undergraduate school. We had a couple organizations that dealt specifically with those interested in medicine, those who were pre-med. And I'll list some of those. I know that some of these are just for Stanford students, so it might not be helpful for everybody, but there are some programs that are for those not just at Stanford as well. So one of them was the Stanford Pre-Medical Organization. I feel like most schools have some type of pre-medical organization like that just provided a lot of information about people who are interested in medicine. But one of the ones that stood out to me the most was what we call SCOPE. It's Student Clinical Opportunities for Pre-Medical Experience. It's an organization that I led while at Stanford, and this placed about 60 undergrads at Santa Clara Valley Medical Center, and we worked in the ED while during shifts that a lot of when there wasn't a lot of volunteers, and it really allowed us to get a sense of what providing medical care was like. It was an 8-hour shift. It was a lot more intense, I think, than some of my other pre-medical experiences, but really gave me sort of a view of what it would be like to be a physician. We did things like I interpreted for Vietnamese patients, and when the Vietnamese interpreters weren't available, we provided patient comfort and care, gave them blankets and things like that. But also we would follow the physicians around, and they would give us a lot of information about their thought processes, sort of things that we should, interesting things they wanted us to know. And I think that really gave me more of a better understanding of what it would be like to pursue a career in medicine. And I think that for people at different schools, I think SCOPE is open to a couple schools in the Bay Area. If you're at UC Berkeley, San Jose State, I think a lot of people have come from those schools as well to join this program. But I think in general, if you go to your local hospital, I feel like there are volunteer opportunities that you can get involved in. I know that most hospitals have these types of opportunities that some of them are just you go and you give newspapers and things like that. But I think that if you connect with people who have been in some of these types of programs, and they can connect you to people that they know that can give you more in-depth experiences that would allow you to get a better understanding of what it would be like to be in medicine. Yeah, hopefully that's helpful. Evan?
Yeah, Janet, I would definitely echo a lot of those things. That's kind of how I got involved initially in a lot of healthcare, was just kind of seeing what it was like, and part of seeing that is just kind of at that really basic level, being at the hospital. Most of the things, for reasons which I think become very obvious to you the further you get into medicine, you can't really do a lot at the beginning, and that's good because I've been in medical school forever and in public health forever, and you'll realize that there's so much to learn when taking care of patients. So, but you can by being there, you can see, what types of experiences there are from kind of like an outside level. You can see what, what hospitals are like, all of that stuff. For me, and since Jenna already covered that, I'll talk about some of the community work, which Jenna, you probably have a lot to add on this too. For me, I got involved in a lot of community work as well, and I want to see kind of like how people kind of worked with health things outside of hospitals, outside of academic centers. So we did like some health fairs. I volunteered at like a local mental health organization. Did do some work at a hospital on some outpatient basis, and then obviously got involved in like some research that was more community based, and subsequently some public health work that was much more community based. And that was also really important because there was a whole mix of different, kind of care models and different types of care practitioners that were in all of those environments. So just great ways to kind of see what's going on. As an additional thing, and you realize once you have these experiences, which I'm sure many of you have already had, I think all of us go into healthcare with this idea that we can help people. But what I've realized the further along that I've gotten is it is really kind of a two-way street. I think many people really know the important health challenges that are facing. They know obviously their own bodies. They know a lot of things that you actually really need to know as a healthcare professional, and you just can't know unless you're there, unless you're talking to people. So I would say that was one of the most important things for me, was being in those situations, not like going out and be like, I'm the person who knows this stuff, but going out and realizing that people out there, not only across the health, the spectrum of healthcare practitioners, but just people really know a lot that can really help you do your job as a healthcare professional. So I would say that's the other great benefit of doing community work. And kind of to get to the point of this question, those are the things that really make you not only have a real understanding of what it means to get into a career, which is something that really helps you actually end up getting to that career, but it helps you make good choices about the things you really want to do. So I would say getting deeply involved in organizations, having an open mind, wherever that is, whether it's a facility or the community, will really help you.
Thank you. And going along that line, and as sort of as a follow-up question, I wonder if you could talk a little bit about comparing and or contrasting the sort of clinical and pre-med experience you had versus the public health experience you had. And specifically for you, Evan, you've had some fellowships in the policy world, and Janet, you spoke at length also about your community experience. But I wonder, for our attendees who are considering both public health and medicine, and obviously the fields in and of themselves are incredibly broad and varied. I imagine there's a lot of experience you can get, and you touched on just some of those. But if you were sort of having to make a game plan and start action planning, are there any like core experiences that you think someone might really need in the public health sphere, if to really inform the clinical side of their practice that they plan on pursuing down the road?
Jen, do we want to keep the order, or do I want to do
you
first?
You can go ahead if you have.
Sure. So I think I'll start with the last part. I think one of the most important things for kind of like the public health experiences that you can get is just kind of seeing a little bit at some level, whatever that is how healthcare decisions are made. So whether that's at a community facility, kind of behind the scenes, what are the directors of that facility doing to make decisions? What are the people who say, here's what we're going to do next for this group of people? How do they make that decision? You could do that at health department. I did it in DC. It's a very extreme example and often not a very representative example. But then I also worked at a global health organization where that was also happening. Research to some extent can have some of that. Hospitals, probably it's going to be a little bit more difficult to get in that situation. But I think the great, kind of the benefit of that is you really see what type of information you need, and you'll see many different models for making those decisions. And I think as a public health person, ultimately your job is to help those to either make that decision yourself, and depending on how you get involved in community organizations, you might be making those decisions yourself, or to inform folks who are going to make that decision, to give them the best possible information. And that information, as you'll see as you have these experiences, comes in many different forms. So part of getting those experiences too is seeing, what types of things do you need to develop expertise in as a public health person in order to really make a difference. So yeah, I think those are some of the experiences on the public health side.
So yeah, I agree with what Evan has said, and I think a lot of the skills that I've noticed in public health have to do with advocacy, and it's really about figuring out what your constituents need and how to address those in the best way possible. And I think that the skills in advocacy and determining those needs and then making a plan of trying to make those into reality have really spilled into some of the clinical experiences that I've had. So I think some of the most powerful experience I've had is really advocating for my own individual patients and really understanding their needs, understanding what impacts their decisions and what behaviors they perform, and what health factors impact them, and advocating for what they need in addition to addressing some of the medical issues that they presented with. Because I think that, like I've mentioned before, a lot of the social factors, especially in underserved communities, really impact health more than I had ever imagined. And I think my experiences in public health have really informed my ability to understand the clinical side of that picture. And I think that gaining skills in advocacy, whether that be through policy, through media, whatever it may be, being able to get your voice across and being able to use your voice to speak the messages of your constituents, of the people who you're trying to help, is really what's going to help on the clinical side as well. And so I think that for me, advocacy has been the biggest thing that I've learned in my public health training thus far.
Great. Thank you so much for sharing. And I want to transition a little bit into your training, your graduate school training. I know a lot of our students and our alum and our interns have a lot of anxieties and fears about pursuing graduate school. So I wonder if you can both speak a little bit on some of the challenges that you might have experienced or that you might see your colleagues experiencing in terms of your public health and medical training. Specifically, as you both talked about, the path to careers in the health field are not always linear. And as you both spoke about, there's so many different things to become passionate about and to want to do and to change. There's definitely obstacles and shifts in interests, and that's something that we see with a lot of our students and questions we get. So I wonder if you can talk a little bit about some of the challenges that you or your colleagues might anticipate or run into in your graduate training, and any advice that you might have now that you wish you had had then.
Evan, do you want to answer, or do you want me to?
Yeah, sure. I'll kick off. So, I mean, I think there's a couple of different layers of challenges of getting, kind of in the next steps of this. I think the first one is, obviously, and this is part of the point of this, is kind of deciding what direction you want to go. And for me, I was like obviously kind of undecided. Undecided isn't the word, but I jumped into a really long training program that really had a really very kind of split down the middle, combination of both things. That doesn't really make sense for everyone, and may not be something that you in your current life, and certainly I might advise myself differently in my past life, might want to do. I would say the kind of advice that I would probably provide myself would be just kind of getting. I think first, not worrying about doing everything. I think I was really concerned about being involved in research and community work, and really taking advanced classes, and every single being in leadership positions and every single thing I could do. And you have to do some of that stuff just to get into graduate school, that already. But you don't have to do everything, and no one does everything. I think one thing I probably would have told myself, and I kind of continue to tell myself, is the person who's really great at one thing, they're not great at everything, and you should never hold yourself up to the standard of those other people who you're probably constantly running into all the time. Everyone starts in the kind of position you're in, which is not in graduate school. So, don't worry too much. Don't compare yourself to other people. Just, spend time, seriously, enjoying your experiences, engaging in those experiences, and then put in the work for the things that matter. So, your classes do matter. You do have to take some exams which matter, and so take those things seriously, but don't ruin your life trying to do everything all the time, because that will make you bad probably at everything, and won't make your experience as a health professional, because you're starting now, won't make it that fun. So those would probably be the things I would tell myself.
I feel like I agree with Evan because I also have a really diverse set of interests, and I think that my path has been non-traditional just because I wasn't really sure what I wanted to do. And I think that I initially began by doing some of the things that Evan said not to do, was do all these things that I think that I need to do to get into medical school, but not necessarily things I was interested in. So I started off with basic science research because I thought that is what I should be doing and not what I was interested in doing. And when I finally realized that I was so much happier doing the things that I was passionate about, community work, global health work, I think that shines through much more truly than, doing all these other things that you think that they want to see. And so I think that I agree with Evan that do the things that you want to do that shows your passion, because that people can see that in your application. But also don't be afraid to dig deep. The things that you really are passionate about, go all the way. Take the energy and take the time to really investigate and see if that's really what you're interested in. So, and there's a particular area of medicine or public health that you're really interested in pursuing, go for it. Find the mentors that might be able to help you gain more experience in those interests of yours. And also, when getting to, I think, medical school, some of the challenges is really it's rigorous. There's a lot of work and time that you take to learn all this information, all the clinical information you're going to need to know to take care of people in medicine and in public health. And I think that it's that understanding that it's okay to take the time to take care of yourself is important, because I feel like a lot of my colleagues, when in the beginning of med school and graduate school, really didn't. I think we just focus a lot more on spending time with our studies and not really taking care of ourselves, and I think that definitely catches up to you. And so I think my biggest advice about fears about graduate school is do what you're passionate about, because I think that in the long run is what's going to make you happy and what is going to lead you to success, and also remember to take care of yourself at the same time.
Really great advice that I can't emphasize and echo enough. And I have individual questions for each of you, both Evan and Jenna individually, and then sort of shift gears a little bit into more broad healthcare landscape questions before we conclude. So maybe to start with you, Evan, you in your bio talk about your interest in international health, and we have quite a few attendees who share an interest in working internationally. You talked about some of the experience you've had, but is there any specific advice you would give to these students who really see their longer-term career on the international scale? Is there anything that they might need to consider or think about or plan for additionally in order to be successful?
Yeah, I would say that the first thing, and this has been one of my most recent, most important insights, is that the best healthcare practitioner that I know was not trained here. She didn't work here until recently. She grew up in a totally different area of the world. She doesn't speak English super well, but she's the best doctor I've ever met in my whole life. She is fantastic. And I think that there's a lot of important things in there for me. First was that I believe that Americans do healthcare the best. There's really no evidence to suggest that's even remotely true from both a public health perspective and also from a clinical perspective. The second thing is that care can be delivered effectively in a lot of different ways. Many people have different practice patterns than us, and those things make a lot of sense, and they do really well. The third thing is that people from other countries know a lot about healthcare, and if you actually listen to them, they'll teach you a ton. They'll teach you a ton of stuff about your practices that you use in the intensive care unit at Hopkins. They really have things to offer. I kind of picked a bad example because she's a physician, but I've learned a ton from people who are community health workers and people who are not healthcare practitioners, like I mentioned before. I think we as a country and many care practitioners, especially people who are born here or people who are educated in the U.S., go to other places and think that they have a lot to offer, and it's actually usually the opposite. These are folks, care practitioners or people who are living in extremely low resource settings who would probably do better than us given the resources we have here in our own system. So my perspective is, go into these situations with a lot of, not just abroad, obviously, but in any context with a lot of humility, ask a lot of questions, be the person in the room who's not talking, who's asking good questions to understand what's going on. That's the biggest way that you can make an impact in settings that are different from your own. And really, there's not a huge difference, I think, between a lot of the experiences that I've had, in like rural Uganda and experiences that I've had in inner city Baltimore. It really is. There are themes out there. There are similarities out there. You have to ask the questions. You have to be the person in the room who's listening. I think that's how you really start in global health, and you're trained often at Hopkins and many other places very differently. You're trained to be a very different person, and I found that is very ineffective. So so that's my kind of 2 cents. I have a lot of ideas in terms of kind of specifics for getting into global health, and we can talk about those later if you'd like.
Perfect. And if in any of these conversations you have resources or follow-up information that you'd like to share, I can definitely pass that along to the attendees afterwards. So thank you. And Janet, we also have a specific question for you, really about the program that you were a part of. You spoke about really realizing that you wanted to get public health training after a few years of medical school. And can you talk about the program you were in? And there's so many opportunities or so many different options for doing an MD and an MPH, whether it be a joint program or doing your MPH first or doing what you did. And so the question is really, can you follow up and expand more about the program that you were a part of and why you chose to go that route?
I'm sorry, the program that I participated in, the organization that I worked with.
I'm sorry, your public health graduate program. So you talked about taking time off from medical school to do your MPH. How did you do that? What was the program you were a part of? And compared to all of the different options that people can now do to combine both of these fields in so many great ways, why did you choose that path?
Okay, great. Thanks for clarifying. So when applying to medical school, I actually did apply to MD, MPH programs, and because I knew that I wanted to do my MPH at some point. But I realized that I wasn't sure when I wanted this training, and I didn't want to confine myself to do it during medical school if I didn't think I would have the experiences to be able to appreciate the skills that I would gain in the MPH. So I decided to do a traditional MD training. But during my third year of medical school, I realized that a lot of the patients that I worked with, especially the underserved populations in the local community hospital, made me realize that I really did want the skills to be able to provide more culturally sensitive patient care, to do the research that I wanted to do to impact these patients on a community level. And that's when I applied to the UC Berkeley UCSF program. And it's sort of an affiliation program between UCSF and UC Berkeley. It's not really a joint program. They do have their own joint program. It's a little bit different. You apply for that before you start medical school, and that's a joint program. But I decided to do it this way because I wasn't really sure what I wanted to do when I started medical school. And so within the MPH at UC Berkeley, there's a lot of different concentrations, be that epidemiology. They also do have a minor concentration in global health for those who are interested. There's maternal and child health, and a lot of other concentrations. And my concentration specifically was in the interdisciplinary concentration, which you probably aren't surprised given my diverse interests and my indecisiveness about what I wanted to do with my career in medicine and public health. And within that concentration, I chose that because I was able to basically take a couple of core classes that were required for all public health students, but then really design the curriculum to fit my interests in impact evaluation and health policy and technology and in working with underserved communities. And so I did an 11-month course where I combined a lot of those interests and took a lot of classes that gave me both quantitative and qualitative skills, and also just some basic training in public health policy and things like that. And as Olivia mentioned, there's a lot of ways that you can incorporate public health training into your career. So you could do your MPH. I know a couple of people have done their MPH before applying to medical school, and that usually is a 2-year program. And then if you do a combined MD, MPH in some way, whether that's an official combined program, a formal program that's 5 years, or if you take 3 years of medical school, take a gap year to do an MPH, whether that be at an affiliation school with your med school program, or a lot of my classmates from UCSF went to Johns Hopkins or to Harvard or to UCLA or to a lot of other great public health programs, just depending on their interest, depending on the focus that particular public health school has that they were interested in. So you could do it that way as well. So you could explore other areas of the country that you're interested in, or just explore other areas of interest that maybe the public health school that your school is affiliated with doesn't have. Or you can even do it after. There are a lot of people who do complete their MD and then get their MPH training much later. And there are also residency programs that combine MD and MPH. And the nice thing about that is they actually cover your MPH training, so you don't have to pay for the fees for that. So there's a lot of different ways to include public health in your medical training. And I think the great thing about both medicine and public health is that there's so many different ways, so many career opportunities that you could really, participate in that combine a lot of those interests. That I think some of the things we were talking about, like the intersection between public health and medicine, you could be the head of a department of health, or you could be on the ground working in, a third world, lower resource country, or you could just be working in, community organization in your local area. There's so many different ways for you to get involved and to incorporate public health and medicine into your career, whether that be more medicine heavy or more public health heavy. That's really up to your interest. And I think that's a great thing about both of these careers, is that there's so many ways for you to contribute to and give back to the community, and just follow your passion and your interests at the same time. I hope that answers the question.
Perfect. Yes, it was very thorough, and I also think it's a great segue into sort of the last 2 questions that we have. We have a few minutes left, really talking about the public health and healthcare landscape more broadly, and the role of clinicians and practitioners in that landscape. So these last 2 questions are for both of you. It's just that as we are in a really, I'll say, dynamic and exciting time in health policy and shifts in healthcare coverage and delivery, what might you say is the role of the practitioner and clinician in these sort of policy decision-making arenas, and what do you see the role of the practitioner and clinician being moving forward in the broader health policy discussions that are so candid right now?
Jenna, you want to keep going?
Sure. So I think that, the role of physician is, to provide care for the patients, but also as a member of that patient care team. So I think a lot of the push recently, especially with the ACA, is to really have shared decision-making with patients, for, physicians to provide patients with all the information they need, but also to really make the decision with their patients, and to include patients and patient preferences in the decisions that are made. And I think that also scales up to a bigger level, where physicians as a group are leaders in a movement to bring healthcare more healthcare delivery more equitably and more efficiently at the same time. Given how much money we spend on our healthcare system, it's really important for physicians to understand how they can be more efficient in using the resources with evidence-based medicine at its core, but also thinking about the costs and the resources that we use in making the clinical decisions we do to provide care for our patients. So I sort of see them in a dual role. So one, on a more micro level, working individually with patients with shared decision making, helping them with all the information they need to make smart choices, but also informed choices, and also in a way that physicians will be more informed about the costs of their decisions and of the care that they provide, and being leaders in trying to do that more efficiently and delivering high-value care, so quality care, but at a lower price. And that way we can provide the limited resources we have to more people and more equitably, and try to address some of those health disparities at the same time.
Yeah, I think all that is super true, and I think one, kind of taking it a step further, I think in addition to those roles that physicians have, I think doctors will always be a central part of the healthcare system, really in all countries. It's oftentimes a little bit unavoidable, but I think that role is changing in many ways. You look at the U.S. population, there just aren't enough doctors to take care of all of the people that need to be taken care of at the level that they need to be taken care of. And there's not really any force that we can recruit doctors from other countries, we can train more physicians here, but that really is not going to make up for it. And so there's a lot of clinical care that needs to come from people who are not trained as physicians. And by that same token, there's a lot of decisions at those levels I was talking about before that need to come from somebody. Physicians, although they are often have been traditionally in these decision-making roles, they aren't trained to make public health decisions at all, really. They're trained to make decisions explicitly for individual patients. And like I mentioned before, when those decisions are made by folks like that for populations, they aren't always great decisions. So, I see that there being important roles, obviously, for physicians in the future, but the spectrum of decisions that need to be made are quickly kind of escaping the training that many physicians have, and many of us, I'm sure Janet is also in this boat, are trained to be to practice care in very specialist environments. And so, that does not lend itself to working in the community like many of you have experienced. It doesn't necessarily lend itself to even working in government or working in community organizations to make those decisions. So there's going to be a huge role for public health in the near future. ACA, as Janet mentioned, is setting up a bunch of changes that I think will happen to the U.S. care system because people are seeing these issues, but also because these changes have to happen. So there's going to be I think a really big explosion of public health and medicine that's coming. A lot of exciting changes are happening, a lot of changes that are aligning us with better care. So it's going to be a great time to be involved wherever you end up.
So as we close out on time, I just want to maybe just close on that last point you just made, Evan, really the future of public health and medicine, and as I spoke on the changing landscape. So I wonder if in closing, if either of you want to touch on any sort of trends or changes that you foresee in the near or distant future in terms of our healthcare and public health landscape, and how our students that are joining today who see themselves working in both of these fields, where they might work in terms of careers that will come up and will develop as a result of these new trends, and maybe how us all of us as public health and or medical experts and advocates can be impactful in this new landscape moving forward. So I wonder if to close, if you can just project forward a little bit and what your thoughts are and how we might all fit into it.
That is a tough question.
I'm sorry, put us on the spot very late in the evening, very late in the evening. And something you talked about, Evan, is some of these new opportunities and new careers that you see coming up. And I think for people who are now out of school and are now thinking of all of these career directions, something we've talked about are these emerging careers and these emerging opportunities. And something our founder Jeff spoke about in a previous webinar is that some of the health careers or even health issues that we're working on now, we weren't even able to really wrap our heads around 5, 10 years ago. And we certainly don't know everything that will be 5, 10 years in front of us, but we can sort of try to foresee some of these trends and changes so that we might best serve our communities and our populations. So whether it be something that you're personally passionate, interested in working on, or trends that you're picking up on, sort of as a heads up for all of us propelling down this path, if there's anything you'd like to add or close.
I would just say real quick that there's a lot of different ways to be involved in healthcare. And many of the people who are training me at Hopkins were used to an environment where they made all decisions and everyone else followed out, kind of carried out those decisions. That is no longer true, possible, ideal, any of those things. Healthcare is a very collaborative environment. When we round in the morning in the PICU, we round with 4 other teams and essentially 6 or 7 other types of providers. And people who are, nurse practitioners are making decisions. Physician assistants are making decisions. Complex people who train for 14 years in neurosurgery are making decisions. The respiratory therapists are making decisions. All of those things go into making people better. And there's lots of different roles for people who are interested in doing that, interested in caring for people in specific specialist ways in the hospital. And I think that that's a big change from before, is an important and useful change. So there's lots of different ways that you can be involved. The same is obviously true for those bigger policy decisions like I alluded to earlier. I think the important thing is really for all those people know patients and they know healthcare and they know what that experience is like because they're there every day and they're living it. And I think that in making your decision, you have to get into those environments, whether it's again that behind the scenes decision or it's in the hospital in whatever way you can, or if it's in community organizations, you just have to be involved in those places to really help yourself make a decision. I really like what Janet said earlier too about choosing something that you really like. Your parent or grandfather or person on TV may have been a doctor or not, or whatever it is. That's not really a good reason to go into medical school now. All of the things that make up health professionals now, all those things are dramatically different. So, go find experiences that, seem like something you might want to do, spend time with people who are doing those things, and, like Janet said, you'll actually do better. So, yeah, that's, I don't know if that's like advice on, I don't know if that's how the healthcare system is changing, but I think that's how healthcare practitioners have to prepare themselves for the future now.
And from my end, I think that what Evan said is I totally agree with that. Healthcare is definitely changing, and I think we all see that in our lifetime. Like what medicine was 20 years ago, 50 years ago is not what it's going to be now, and in the next few years. There's a lot of changes coming down the pipeline. And I think a lot of changes that are going to be for the better. And I think what's really important for us and for those of you who are thinking about careers in medicine and public health is be open to a lot of these changes that are happening. Be innovative. Think issues that you notice and you think could be done better. Speak up and try to get that implemented and see if that really will provide better care to the patients or to the people or the population that you're serving. I think a willingness to innovate, especially in such dynamic fields of medicine and public health, will be important as things do change in the next 5, 10, 20, 25 years. I think most importantly is that listen to your constituents, listen to the people that you are serving, that you're working with. Willingness to learn from them as much as they learn from you is going to be really important down the line as as the field changes, and being open and willing to try new things, to innovate and learn from other people as much as you learn from, your mentors is going to be really important. And it's an exciting time, and I really wish all of you guys the best. And please let us know if there's any way that we can help you along your path. I think that some of the best advice I've been giving have been from, mentors, obviously, but also people who are around my own age who are recently gone through sort of some of the applications and the things that I've been going through and all the questions that I was answering about medicine and public health. And I think that tapping into those resources will be important. And then using those networks and connections as you move forward will be helpful, as well as you move into this field and as healthcare changes. And excited to see you guys along the way.
Perfect. Thank you so much to both of our panelists, Evan and Janet, for joining this evening and sharing so much about their own journey and insights that they see and can share with all of you. So thank you so much to our panelists. I just want to close that we will be having this webinar. We will post this webinar on myhealthcarenavigator.com. You can already see some of the webinars we've done in the past, and you're welcome to access those now. We also have, our job postings, our internship postings, and a lot of other resources that you can access right away. And next week, we will be moving our webinar time slot to Tuesday, the 10th, which will be hosted by our founder, Jeff Oxenstein, on discovering your authentic health career. So I know a number of you are still sort of grappling with where you see yourself going, and he'll spend this time going over sort of a framework and some strategies that he uses with hundreds and hundreds of students on how you discover your true and authentic career path and what steps you might be able to take to move a little bit closer to that. So that's what we'll be doing next week. You can also register on GoToWebinar. This is posted on our website as well. So with that, I just want to say thank you. We went over on time a little bit, but thank you for joining this evening. Thank you to our panelists, and have a great evening.
My pleasure. Have a great night.
Thank you, everyone.
Thank you so much. Have a great night. Thank you.